Okay, which of the following is the most likely etiology of the patient's condition? Autoimmune response against myelin basic protein, so like multiple sclerosis, direct viral invasion of central nervous system, NMDA receptor antibodies, oligoclonal that myelin basic okay, oligoclonal bands of immunoglobulin G, and a vitamin B12 deficiency. This is a 9-year-old boy brought to the pediatrician by his parents due to a 3-day history of progressive weakness and difficulty walking. He had a febrile illness with sore throat 10 days ago. On examination, the patient exhibits bilateral lower extremity weakness and diminished deep tendon reflexes. A brain MRI shows multifocal demyelinating lesions. Further analysis of CSF shows moderate lymphocytic pleocytosis. So he's got the illness trigger and then the lower extremity weakness and diminished deep tendon reflexes. So this is Guillain-Barré. So Guillain-Barré is a like demyelinating condition. Um, Let me think about this for a minute. It's not a direct viral invasion because it's a and it's not oligoclonal bands of immunoglobulin G because that's MS and he doesn't fit it. He doesn't fit vitamin B12 deficiency. There's no clues in the um things. I think it's an autoimmune response against the myelin basic protein. I think that's what causes the demyelination.
Bingo, right? Good, 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 right? So definitely for sure, right?
I had my
Um,
diagnosis wrong.
say it again.
I had my diagnosis wrong.
Well, I mean, it's kind of like that, right? It's kind of like Guillain-Barré for kind of the bottom, right? But the thing with the Guillain-Barré, it doesn't affect kind of a lot of times it doesn't affect the brain. So the multifocal demyelinating lesions of the brain, you're going to be like, oh, what the heck? That's kind of weird, right? But you can kind of think that it's going to be an autoimmune issue because it fits, right? It fits, right?
Mhm.
3-day history of an infection, right? Sore throat 10 days ago, then all of a sudden, all this neurologic issues. So it has to be some kind of autoimmune response, not the virus itself, but an autoimmune response. And the only answer here that can kind of fit that is going to be kind of A, right? Which is similar to kind of Guillain-Barré, but obviously this also attacks the brain, which is no bueno, of course. But yeah, definitely for sure. It's kind of within the same realm of diseases, right? So in all intents purposes, you were pretty much correct. You know what I'm trying to say?
Yes, but
Yeah.
that definitely helps expand what I needed to know.